With the coronavirus stalling the economies of many of the world's richest countries, the UN has warned of a looming financial tsunami for some emerging nations. The United Nations has called on these richer nations to provide an emergency package to help developing countries cope with the crippling impact of the COVID-19 pandemic on their vulnerable economies. Now, to get some insight into how the proposal would work, I'm joined by the Secretary-General of the UN Conference on Trade and Development, Dr. Mukhisa Kituyi. Dr. Kituyi, you're welcome to our programme.
Thank you very much and good morning.
Now, we're not talking necessarily, first of all, about the medical systems, the health systems of these countries, although I suspect that many of them would be under severe pressure if they are afflicted by the COVID-19 pandemic. We're also talking about their economies and how they depend on international trade to survive.
Yes, indeed. In fact, our proposals are not to separate what we consider the necessary Marshall Health Plan to just build up the capacity for testing, for tracing, for isolation, and for curing, but also that the direct hit because of interruptions of trade, because of different factors which are putting them under acute financial strain right now would be very important.
There are industries which absolutely depend on international trade. And I'm thinking, for example, of flower growing for the European market in Africa. And of course, that's a kind of a discretionary purchase. So I'm sure that market has effectively vanished for those producers.
Yes, absolutely. I come from Kenya. And I know how important the floriculture and horticultural exports to the European Union have been important for the small-scale farmers in the country. And already with the nightmare of logistics, the collapse of marketing networks, they are already under severe strain. Most of the people are not able to dispose of the huge investments. And like all perishables, once a flower crop misses the market, it cannot be stored for another day. So this is just an example of the large range of cases. We even have an even more compelling case, particularly for emerging economies, that there has been a rapid loss of financial outflows, particularly the portfolio investors who are taking on a flight to safer markets. And so not only causing major strains on the local currencies, but extremely devaluing the assets into which they had invested. And these are compounding the health challenges already being faced.
Now, many of the richer countries will say, listen, we are having to borrow billions to support our own economies, and they'll say, we simply don't have the money to help emerging nations. What do you say to those arguments?
Okay, there are two parts to that question. The first part is what we have seen with recovery and the reemergence of the virus in East Asia tells us that no country can ride out this problem unless all countries ride it out. So if we do not help the developing world also to flatten the curve, it will come back to haunt the rich again. But the second level is this. We have demonstrated over time that developed economies really do not have a shortage of funding options, especially those who are in the enviable position of issuing international reserve currencies. With a combined income of approximately 60 trillion US dollars, they can make investments to support the world, not as much as they're doing at home, but in a way that has impact elsewhere. And third, the special drawing rights at the IMF. These are resources that exist. Some can be reallocated, others can be enhanced to raise the necessary resources that can then be used to strengthen the reserve currencies of the emerging and poor countries. So the options are clearly available. And the third one is all the DAC countries, the donor countries, committed to an ODA of 0.7% per annum. Now, over the past 10 years, very few have reached that number. In fact, indeed, in the year 2020 alone, if they pay up the pledge of 0.7%, that will be enough to raise the $500 billion necessary for a health Marshall Plan for developing countries. So it is the political will and the solidarity and the self-interest of knowing that supporting the others to fight this fight will reduce the pressure of reinfection when we are over the curve.
And I suppose if you take a broader view, we do business, of course, all of the wealthier countries with the emerging nations, and an investment in their survival ultimately will be good for us.
Absolutely. I mean, the thing is that we're just coming out of a decade of economic migrants out of Middle East and parts of Africa who have been a pressure even on the politics of Europe. Now, imagine if we do not do anything about it. The gains of building domestic productive capacity and livelihoods going away. You will have a wave of health migrants, which will be much more disorganized and much more frightening. So I think self-informed self-interest in the medium term requires that to have a global view to a global challenge.
So, how would this fund, this international fund, be assembled? I mean, what is the mechanism by which this multi-trillion-dollar fund would come about? Who is going to be the instigator?
Okay, we've suggested a number of three different ways of dealing with this. For example, first, by scaling up existing systems of the special drawing rights, which commits IMF member countries to mutual support by allowing those in liquidity crisis to borrow reserves from the others. This can be scaled up to $1 trillion. Now, in the Trade and Development Report of UNCTAD this year, we have argued that 1 trillion, which is equal to 730 billion special drawing rights, should reach the international reserve accounts of developing countries fairly quickly. This could be achieved through new allocations and reallocating current allocations that have not been utilized by some of the members, put this at the disposal of the developing countries. A second source will be the cancellation of up to $1 trillion of developing countries' sovereign external debt. Now, this will be amounting to up to $1.4 trillion if it was done, that is due in the year 2020. We estimate that at this time of crisis, freeing them from that burden will go a long way in reducing the hardship they're already experiencing. And the third, we have calculated that over the decade since the financial crisis, an additional $2 trillion will have been reaching the developing countries, as I mentioned, if the ODA had been realized. So we're not asking for any massive new thing. We're just saying, for a change, even only this year, allocate the 0.7% of 2020, and it will cover the $500 billion necessary as the third part of this for healthcare investments.
Dr. Mukhisa Kituyi, Secretary-General of the UN Conference on Trade and Development. Thank you very much for joining us on the programme.